Okay, now we're recording. Hi
Great.
again. All right, thank you. Thanks so much for being here today. I really appreciate you taking the time.
It's
Um,
my
and,
pleasure.
and thanks to anyone who's joining us live or recorded. I appreciate your time as well. We're going to talk about COVID safety in the yoga community. And I mean, I thought we could start by just talking about maybe, well, I could share a little bit about why I asked you to join, and also you could talk about yourself a little bit and
Sure.
introduce yourself more. I should say my name's Jivana. My pronouns are he and him, and I'm the director of Accessible Yoga. And we recently had a thread in our Accessible Yoga community Facebook group about this topic. And there were just such, I don't know, like so many different opinions and ideas around how to be safe in COVID. And it just felt like I wanted someone who really understands the topic. And the thing about you, Stephanie, is you get the medical side and also the yoga side. So I always love to go to you for my medical related questions. And so I put together some of the questions that came up in that Facebook thread. And I think generally I'm going to focus on topics that relate to yoga teachers today, because this is a huge topic, obviously.
Right.
And people who are looking for information about COVID can find that. This is a conversation about the yoga community, right? So again, thanks for being here. Maybe you could say a little bit about you.
Yeah, absolutely. I am Stephanie Munaz. My pronouns are she and her. I am a public health doctor. I have a PhD in public health from Johns Hopkins University. The focus of my doctoral study is on the topic of health behavior. So how we transform the choices that people make that affect health and well-being at all levels. So at the individual level, at the level of family, community, and beyond. And my work as a yoga researcher and a yoga therapist and a yoga teacher is through a public health lens. So I'm not just thinking about the effect of yoga practice on a single individual who's in my research study or in my class or a client of mine, but I'm thinking about how are we bringing yoga to the world as a way to inform transformation on a broader scale. And so when we're thinking about this topic, which is very much a public health topic, so there are decisions that get made about COVID on an individual level and on a family level, but also on a state, national, international policy level, because we're thinking more broadly about how communities are affected. And so I think it's helpful to think about that frame on this conversation.
Yeah, that's really helpful. I mean, public health is such an interesting field. I think in a way the work of accessible yoga is really related as well to public health, but I never think of that term, and so it's awesome to hear that. I think the reason I brought that question up to our community last week was just that things had changed drastically, that with COVID. I mean, it really felt in the US at least like things were getting a lot better. A lot of yoga studios had opened up and we're having in-person classes. I live in Santa Barbara, California, and there were studios open here.
Yeah.
I mean, I think they might still be open, but I think there's another wave with Delta variant happening, a lot more virus out there. It seems like issues come up all over again. And one other thing I noticed in the thread was that there's a lot of difference between different countries and the way they're addressing this. And I think what is hard for people to understand is that the US is all over the place. Like it depends not only on the state, but even potentially the city you live in, and the rules are different everywhere. I think in some places there's more clear guidelines for business owners, like a yoga teacher, in terms of what they should and shouldn't do. So I think in a way this is selfish, that I think as a American-based yoga teacher, I feel like there's so little clear information for us. So I was hoping you could help us with that.
Yeah, so I think we are all fatigued. We are all experiencing various levels of grief and different kinds of trauma. And we were starting to feel like maybe things, at least in the US, where vaccines are available to anyone 12 and over who wants one, that we were on the way out of this and that it was only going to get better from here. And I know that's different in other countries. And so I think that, the rise of the Delta variant has thrown a monkey wrench into all of our plans of how we thought this was going to go. And
Yeah.
people are exhausted and they don't want to do this all over again. I think what's challenging as an individual yoga teacher or studio owner is that the guidelines are different everywhere because the policies in a particular location are not driven strictly by the science, because they are science filtered through politics.
Yeah.
And so there is what the science recommends, and that can be complex and nuanced and difficult to understand or apply. And then there's what the politicians do with the science, which sometimes is a combination of what they think is palatable for their community in the direction of the science, and sometimes is a complete disregard for the science. And so as an individual studio owner or yoga teacher, if you only follow your local jurisdiction's guidelines in terms of, is there a mask mandate, et cetera, then you may be more informed by politics than you are by science. And so at a minimum, you are required to follow the regulations in your jurisdiction, but that doesn't mean you can't go beyond that if the science suggests. And then unfortunately, it's up to us to make decisions about what the science says. And frankly, the vast majority of everyday citizens are not trained in how to do that. I think that's unfortunate. I think we should be learning this in high school. But the reality is, Jeevana, you come to me for questions about this because you're not reading the clinical trials directly and determining, whether or not you think that they were rigorous enough and how to interpret the findings. And most people aren't. So it becomes complicated. The bottom line is that the Delta variant is far more transmissible. And this is a Delta because it's not the first variant. We've had variants before because a virus mutates, and a virus that's spreading rapidly mutates more rapidly. What is different about Delta is that the earlier variants behaved similar to the initial SARS-CoV-2 virus. And when that brief was leaked from the CDC that said something like the war has changed, that's because it's a different adversary now. And so we have to think differently about our plan. And all the plans we made were based on a different version of the virus.
So how does that impact us in yoga studios right now? For example, like if, how do we decide if it's safe to have in-person classes, indoors, outdoors, with masks? I mean, how do we make those choices?
Yeah, there are so many factors to consider. So the more protections you have in place, the more protected you are. If you think about having protected sex, for example, you don't want to use just one method, right? You combine multiple methods and it reduces your likelihood of an adverse outcome. And that's, if we're talking about sexually transmitted diseases, this is a different kind of disease. And the more layers of protection you have, the better off you are. And there are drawbacks to different kinds of protection, right? So yes, wearing a mask is very effective. It also may be uncomfortable, especially if you have respiratory challenges, especially if you're exercising vigorously. Yes, vaccines are incredibly effective. Not everyone has an immune system that can mount a response to a vaccine. Yes, ventilation, improvements in ventilation systems are effective to an extent. Not everyone can retrofit their HVAC system in their studio, right? So the more layers of protection you put in place, the better. And you have to take into consideration, what is the level of transmission in my community? And one of the links that I shared with you, Jeevana, that I hope we'll get into the thread is, so I'm not biased to Johns Hopkins. They actually are sort of the leader in following and reporting cases around the globe. And so you can look to your location and see what's the level of spread in my area, especially now that the CDC is recommending masking for places that have different levels of transmission. So you can look at what's going on in my community. You also have to look at your own personal tolerance for risk. We all have different risk levels, right? We have different levels of health. We have different levels of, risk tolerance as
Right.
well as risk. So what feels comfortable to you as a yoga teacher, and maybe what feels comfortable is staying online because this is all unpredictable. Maybe what feels comfortable is only teaching outdoors. And then you have to think about, who are my students? Who's the population that I work with? So for me, I'm working with people who have chronic diseases.
Yeah.
They are often on immune suppressing medications. They are often elderly. And so that's another factor to take into consideration when deciding what kinds of precautions are going to make sense for you.
Yeah, so to get more specific, people could look at, well, obviously whether everyone's vaccinated or not. Like there's some
Right.
studios that are requiring vaccination. Does that seem safe to you if everyone's been vaccinated? Does that feel like, or is just another layer, like you're saying? It's just.
Yeah, so vaccination is incredibly effective in preventing severe illness and death, right? Ultimately, that's what we're trying to prevent, is severe illness and death. We're not trying to prevent somebody having the sniffles for a week, right? So the vaccination is incredibly effective for that. What we're seeing in terms of hospitalization and death with the Delta variant is that anywhere from 1% to 0.01% of those cases are vaccinated people. What we call breakthrough infections that result in serious illness and death are generally people who are immune compromised, who are vaccinated, but if you had done an antibody test, probably they wouldn't show antibodies because their immune system was not capable of responding to the vaccine, right? So while the vaccine is incredibly effective for protecting the person who is vaccinated, what we're seeing with Delta that is different from the other variants is that people who've been vaccinated can carry a similar, what's called viral load. So you're not getting sick, but you have the virus in you and you can give it to somebody else. So that means if everybody in the room is vaccinated, all of those people are going to be able to, in all likelihood, prevent getting very sick and dying. But it doesn't mean they won't take it home to somebody in their house who's immune compromised, or to their kid who can't be vaccinated, or to their neighbor or their friend. And that's where we get to the public health perspective on this, is what we choose to do as vaccinated people is not necessarily for our own protection, but it's for the protection of our loved ones and of our community. Now, the risk for a group of vaccinated people getting together is low. The fewer people you have, the less the risk is, the more spread out they are, et cetera. And one option would be to require vaccination. We also want to consider the lens of accessibility. And there are people who can't be vaccinated or shouldn't be vaccinated because they're on chemotherapy, or because they have an autoimmune condition, or because they're allergic to one of the ingredients. So there are a lot of people who aren't vaccinated due to misinformation. There are a lot of other people who are not vaccinated for, a variety of different reasons. And do we want to exclude people who are not vaccinated? That's something to consider. Do we want to have perhaps a class in our studio that requires vaccination so that people who don't want to be around others who are unvaccinated have that option? Or do we want to have classes that require masking so that those who don't feel comfortable practicing in a room with people who are unmasked have that option? But perhaps you as a studio owner or as a yoga teacher feel like unvaccinated people, unmasked people can get their yoga elsewhere. I don't feel comfortable having them in my studio. And so then that's a matter of setting your own personal boundaries about the level of risk that you're comfortable with.
And what is the role of a yoga teacher in making those rules, like in the US, let's say, because I know it's different in other countries, but like so there was some discussion in the thread about our scope of practice. It's not within our scope of practice to ask someone their vaccination status. And I don't think that's really true, but I'm just curious what you think.
Well, I'm a yoga therapist, right? So that adds another, I think, layer of the kind of information that I'm likely to gather. But if you think about when you're having people fill out an intake form to come to your studio, participate in your class, you have them sign a waiver, you probably collect some basic information. I hope that you at least ask, whether they've had any recent surgeries, whether they have, specific movement limitations or things that need to be taken into consideration in order to keep them safe in class.
Mhm.
I think somebody's level of COVID risk tolerance, I think that that's part of keeping them safe and also keeping everybody else safe in the classroom. So I don't think it's unreasonable to ask people questions related to whether, probably you're asking screening questions as they come in. Do you have a fever? Do you have, are you coughing? Have you been with anybody, et cetera? We all have gone through those questions. And that's because you want to keep the other people in your studio safe. So I think that it's very reasonable for us to ask that information. The question is, do people have to answer it? Right? And just as we do have the ability to ask questions that we think are important, they also have the freedom to skip that question or to say, I don't feel comfortable sharing that information. And then you can decide whether you're willing to have them in your class or not. And, I think I'm going to bring up the H word of HIPAA because there's so much misinformation about that.
Yeah.
HIPAA it really originally is about the transfer of electronic records. It was to protect electronic health records that needed to be transferred from one entity to another, like between a hospital and an insurance company, for example. In the age of electronic records, people's health information is moving around in different formats than it had previously. And so HIPAA protects your personal health information from being shared without your permission by a healthcare entity. And those are very clearly defined. So it is your doctor's office, the hospital, the insurance company. HIPAA has nothing to do with what we tell each other about our health, right? It doesn't protect conversations between you and me. It doesn't protect conversations between me and my employer. My employer can ask me my vaccination status. That's not protected by HIPAA, but I also have the right to decline answering that question. So it has nothing to do with HIPAA, but it does have to do with privacy and confidentiality. And so you have the right to ask me whether I've been vaccinated, and I have the right to say, I don't feel comfortable answering that question.
Right. That's helpful. So it's not outside of our scope, and it doesn't really, it's not illegal in terms of HIPAA to ask someone their vaccination status. And what we do with that information is up to us, and also the way people respond is up to them.
I think it's also important to add, though, Jeevana, that just from an ethical standpoint, any health information that is shared with you as a yoga professional should be kept confidential. And so if someone tells me that they had a hip replacement, I'm not going to tell their neighbor that they had a hip replacement. It's not my place to do so.
Right. But that's not HIPAA.
I'm not going to share somebody's vaccination status without their permission.
But it's not HIPAA. That's just ethics as a yoga teacher.
Courtesy and ethical conduct. Yeah.
Right. So I love that, because I think that is already an issue I see. In yoga, sometimes we ask medical information of people in a group setting, and that doesn't feel appropriate. It's like we should ask these questions privately or in writing if we want to get them.
Agreed.
All right. So I know we talked a little bit about misinformation, and I don't know if we have time. Yeah, we have time. I mean, can we go into that a little bit? I mean, talk about,
let's do it.
I think around vaccines in particular, you talked about breakthrough cases.
Yeah.
So the kind of devil's advocate side, what I hear people say is that since people who are vaccinated still carry a viral load and they're still potentially spreading the virus, what's the benefit of the vaccine after all, right? You're still sharing it. You're still contagious, right? Potentially.
So if more people had been vaccinated, we would not have a Delta variant.
Right.
Okay.
And that's, I just want you to say that again, because I
Yeah.
also heard something this morning about how the variant shows that the vaccines didn't really work, but that's not the case.
Right.
That's not the
Right.
situation.
Right. So let me say it again, and then I'm going to explain it.
Okay.
If more people were vaccinated, we would not have a Delta variant. And here's why. The early variants of what the virus that gives people COVID-19, right? SARS-CoV-2. Vaccinations protected people from spreading the disease, right? I said the Delta variant is different in that way, but the early versions of this virus, the vaccination shut it down. If we had reached sufficient levels of vaccination, which we were capable of doing at a certain point, there was a while when we were waiting for the vaccines to be available. Well, once they were, not enough people got them, which gave the virus an opportunity to spread and to mutate. The more it spreads, the more it mutates. And so we have this version of the virus that is more transmissible due to insufficient vaccination. Now, in the US, it became available widespread, but there are plenty of countries that had a very hard time even achieving 10% vaccination. And so it's going to spread there. And that is more a global policy problem, but if you think about it from that perspective, the vaccine is protecting the vaccinated person from the Delta variant. And the more people who are protected, the less people get sick and die.
Right.
And it's possible that future variants of this disease will not only be more transmissible, but will also be more deadly and will also be unaffected by the vaccine, right? We've got to get ahead of this. And the more people are vaccinated, the more protection we have from a public health perspective. And if more people who can get vaccinated do, then the people who can't get vaccinated are more protected. So the kids under 12 and those who are allergic and those who are immune compromised and those who don't mount a response even though they have a vaccination, we do this for them. And that's also, I think, Jeevana, given the Delta variant, why the masking matters. If you're in places that do have high transmission, high case rates, mask even though you're vaccinated, if you're indoors, if there are a lot of people, because we don't know if, how much vaccinated people could be spreading it to unvaccinated people. So the mask then is not for your own protection, it's for the protection of the people around you. No matter what reason they didn't get vaccinated, right? As yogis, I think we want to practice non-harming to the extent possible toward all living things. And so I think what can be very dangerous in this highly politicized environment is an us and them mentality of like vaccinated versus unvaccinated. And I want to protect anybody from getting sick and dying, no matter what, whether you are not vaccinated because you're not comfortable with it, you can't be, or because you didn't get accurate scientific information, or because other people in your neighborhood don't get it and you don't want to be the one that whatever your motivation is, that doesn't matter to me in terms of wanting to protect you from getting sick and dying.
That's really nice. I mean, I appreciate that so much because I just feel like there is so much us and them. And I feel like that's the nature of politics, not public health, and not yoga. I mean, and what I mean, this is going off into yoga philosophy a bit, but I do see a lot of yoga people kind of using this idea of body autonomy, and I have a choice over myself and my body, what I do with myself. And I don't want to put this kind of dangerous vaccine into my body without knowing, it's not FDA approved, or it's not, there have been some deaths related to the vaccine, and the numbers, of course, are exaggerated, I believe. But I wonder if you can talk about that, like
Can I
kind of the
respond to
rate.
that?
Yes.
Okay, so one thing that I think is related, Jivana, one thing people say is that this all happened too quickly, that the vaccines were developed too quickly, and they can't possibly be safe, and that they were rushed through by a government agenda. To that, as a scientist, I want to provide context that mRNA vaccine development has been an entire career for many scientists. There are people who have been working on the precursors of this for decades. And so the fact that we were able to, plug and play, take this virus and turn it into a vaccine in record time is not because it was a rush job. It's because all of the science and the infrastructure and even the equipment and everything we've been investing in for decades. Science is a very slow process. Anybody who's followed my research knows that from the time a project starts until it gets published is a very long process. So if you all remember, those of you who were around in the 90s, remember when they first figured out the genome for a sheep? And it took like a decade to get the genome for a sheep, right? Because the science hadn't been established and we were just working it out, and it took forever and it was hugely expensive. Well, now they can do it in a heartbeat. And it's not because it's a rush job, and it's not because they're doing it poorly. It's because the infrastructure and the science and the systems is there so that it can be done more easily. So it was not a rush job. It was many careers dedicated to this work. That's one thing. Yeah. Another thing is that there isn't enough evidence. The trials haven't gone on for long enough. We don't know what the long-term effects of the vaccine are. We do know what the effects of COVID are. We do have data on what happens when you get COVID, when you have COVID for, there's this whole long COVID situation that's happening. We don't know the decades-long consequences of that, but we know it's serious. And what we're seeing in terms of the side effects of the vaccine pale in comparison in both numbers and severity to what we see from people getting COVID. So if you're deciding whether you think it's safer to put COVID in your body or put the vaccine in your body, I would take the vaccine every time based on the undeniable evidence comparing the two.
Right. And can you talk about the danger of the vaccine? I mean, it seems like there's some confusion about that.
So whenever we conduct a clinical trial, there is a measurement of what are called adverse events. Okay, anything that happens to anyone who's in a clinical trial gets documented. Everyone gets followed very closely, and adverse events are documented and reported. And what happens when an adverse event is documented and reported is that there's a decision made about whether or not it's related to the trial, related to participation in the trial, right? So things are going to happen to people when they're in a study, just like things happen to people in life. So if someone gets cancer, when they're in my 8-week yoga intervention, the yoga did not cause the cancer, but I have to report that this adverse event happened during my yoga study. And then there's a decision made by an ethical body that says, do we think that this reasonably could be associated with the intervention? So we do not know whether things that happened to people when they were in the study for the vaccine happened because of the vaccine, which is why it's so important to compare adverse events in the vaccine group to adverse events in the control group or the comparison group, which is getting a placebo, because things happen to people. And so there's very little difference between adverse events that get reported in the vaccine group compared to adverse events in the placebo group. What is common are the very minor adverse events. So adverse events like a sore arm, like feeling fatigued, like being a little bit feverish, that actually is pretty common, and it's easily attributed to the vaccine. but these more serious adverse events are not as likely to be associated with the vaccine.
Okay, so there was a question asking if there's evidence regarding the unvaccinated spreading the virus more than the vaccinated and to vaccinated.
Yeah, that's a good question. So the Delta variant is relatively new. And it's only very recently that we have looked at viral load in vaccinated versus unvaccinated people. One thing you have to consider is that these are these little samples that are around small events that happen, like what we saw in Massachusetts. There has not been a widespread study to take people off the streets, measure their viral load, and find out if they're vaccinated. So we really don't know, even though we've seen a viral load in some vaccinated people that is equivalent to the viral load in unvaccinated people, we don't know whether people walking around on the street who've been vaccinated are carrying a viral load. We don't know because they don't go to the hospital, they don't feel sick, they don't get tested. So there's very little data to say everybody who's vaccinated is similarly contagious. All we know is that it's possible to carry a high viral load as a vaccinated person. Another thing that we don't know is whether that higher viral load is actually associated with spreading. So just because we can measure that viral load and say, oh, look, this vaccinated person has a similar viral load to an unvaccinated person, we haven't done any research to answer the question of, does that mean that they are necessarily spreading it at similar rates? We're just extrapolating that it's possible that they're spreading it at similar rates. And so it's probably a good idea to mask just in case, because the risk of masking is so low compared to the risk of possibly unintentionally spreading this disease.
Okay. And I wanted to go back actually just to repeat what you said earlier. Maybe you could repeat it around how you're interested in protecting everybody. And I feel like that's so lost in these conversations. There's so much of like one side or another. It's so political rather than looking at what can we do, especially I think as yoga teachers, to protect ourselves and our students, everybody. I mean, to be to me, that's where ahimsa comes in, is how do I protect everyone? Not because this person agrees with me and this person doesn't, then I don't want to protect them.
Which is tribal,
it's just
right?
tribal, yeah.
Yeah, and I think, Jivana, it comes down to a trade-off between what we're calling freedom and responsibility. Like, you know, I have the freedom to wear a mask or not wear a mask, get vaccinated or not get vaccinated. And I want everyone to have that freedom, which discounts a sense of personal responsibility for the greater good. And the way that I have been taught this, the analogy that I think is really helpful is, your right to swing your fist ends at the tip of my nose.
Mm-hmm.
So go crazy with your bad self, you know, do whatever you want to do. But as soon as it affects me in a negative way, then it's no longer about personal freedom. Then it becomes, you have a personal responsibility not to harm me with your fist. And that's why we have things like drunk driving laws. Your right to get drunk ends when you get behind a wheel and then potentially hurt someone else. So I think that that is something that we have to weigh as yoga teachers and studio owners is, am I protecting the right of everybody's nose, not just the right of everybody's fist?
That's a great analogy. And I appreciate it because I think that, like I said, the people I hear who are really like very critical of vaccines and of all the restrictions seem very focused on their personal rights. I feel like there's a real lack of understanding of how that relates to others and public health, which to me is what the yoga philosophy is about. It's about not just non-harm for me, but how my actions affect others, right? That's what we're trying to do.
Right, which is why, you know, so for example, if you don't want your children to get the smallpox vaccine, then that is your right, but you can't send them to public school because it's the right of the other kids to get an education, and a smallpox epidemic in that school is going to interfere with their education, right? So if you don't want to be vaccinated, which is your right, then it's your responsibility to put a mask on in indoor public spaces, right? So I think that we have to balance what personal responsibility we're willing to take given the choices that we make with our freedom. And this is also a very American question to be asking for people who are in countries where they think that we are being so irresponsible by throwing vaccines away when other countries, can't leave their houses because of the inability to be vaccinated. So I just want to point that out because I know, Jeevana, that you have a global audience.
Yeah, and I think that's important to mention again, just that we're both in the US, and I think these are often US issues, but not always. I think other people, I know people in Europe who are, or actually other places too, that are frustrated because there are severe lockdowns.
Yeah.
And like vaccine passports now to do anything. And that was another comment there in the thread that, some countries are just implementing that automatically. And I think people are having a reaction to that. But that's very different than the US, where it just feels like, I don't know what, like a free-for-all. Anyway.
But Jeevana, I think that because it's a free-for-all, then it puts more responsibility on us as individuals to make choices to protect each other.
Yeah, and I think that's the beautiful takeaway for me. I mean, from this whole conversation is just to look at how do my actions affect others, and to really think about that and be more generous in a way. Like, what can I do to protect myself and my family and my yoga students and my entire community? Is that vaccination? Is it wearing masks more? Is it closing my yoga studio? I mean, what are the things I can do that will cause less harm in the world? I mean, to me, that's what yoga is all about.
And I think also I know that we all believe that yoga makes people's lives better, right? And we want people to be able to have access to yoga. And so you closing your studio, what does that mean? Like, how can you continue to make yoga available to people, whether that's online, whether it's outdoors, whether it's, in an alternative space where you can spread out more, or smaller class sizes, or, I think we want to try to be creative and protect people from harm, and also help them to receive all of the health benefits of yoga, especially because people who are suffering from grieving people they've lost, having lost their jobs, having been sick, struggling through, homeschooling their children and being on lockdown. We want all of those people to have yoga, right? And so how do we do that in a responsible way?
Yeah, that's really great. I wonder, I know we have to wrap it up, Stephanie, and I just wondered if you could spend a minute talking about where people can get better information, or, I shouldn't say better, I mean, just clear information that's not really biased. I did share already one link you mentioned from, was it Johns Hopkins? And I'll share the other one.
The Johns Hopkins site is a great place just to get the numbers. So it'll give you the numbers of cases, deaths, rates, like in a certain period of time all across the world. It's a very interactive site. And so that's a great resource if you're just trying to figure out what's the situation right now in my town, or in this place where I might go to offer yoga. There's also, for those who are looking to understand what's a good source of information, because there is so much misinformation out there. And I said earlier that I think we are not literate in that way, that we are not able to be discerning about the science. So there's a great site on UCSF's page, and I gave you that link in the Zoom chat, Jeevana, that's about how do I know if a source of information is good? And I'm not going to say unbiased, because there's nothing out there that's unbiased. Even in scientific research, observing particles makes them behave differently, right? So there is nothing that is entirely unbiased. However, there's a lot that's done to reduce the sources of bias, especially in rigorous science. And so getting information that is less biased is up to us as consumers of information. And so some guidelines on how to know if you can trust a source is on that link. And then especially for the international audience, so the Hopkins site is worldwide, but there's also a site on the World Health Organization. And so the World Health Organization puts information out about outbreaks around the world. So if you're going to travel somewhere, it'll tell you, what vaccines do I need in order to go to this place? Is there yellow fever? What's the situation in this particular location in terms of health risk? And so they have a whole site that's dedicated to COVID-19, and it gives you that kind of information of what's the situation in different countries around the world, what are the guidelines in those places. So that's another helpful source of current information. And then for those who do want to actually read the research, who don't trust what's in the vaccine, want to be able to see what the ingredients are, what the adverse events were that were reported, all of that kind of actual primary scientific research, there is a site that you can go to that collects all of the COVID-19 peer-reviewed literature in the world. So it's not one limited database that we might look at, that's going to be biased in one way or another, but it's gathering it from all around the world. So I gave you that one as well.
Okay, I'm putting them all in the comment section for the video on Facebook. I didn't put them in the order that you just shared them, unfortunately, but they're all there.
They're all there.
Them. And this video will have up, once we're finished here, so people can watch it later and click on those links. Anything else you want to share? I just want to thank you for your time.
Yeah, absolutely. And Jeevana, people can feel free to contact me too if they have questions.
You're sure about that?
Don't contact me to rant, but if you have a genuine question and you'd like, my perspective on something, or related to, especially as it pertains to yoga, I'm happy to answer that. So the best way to reach me is at info@arthritis.yoga.
Okay. I'll put that in here. Info@arthritis. What is it for? Number 4?
Arthritis.yoga.
Oh, .yoga, right.
Yeah.
All right. Thank you, Stephanie. I can't thank you enough. I always love talking to you.
My pleasure, Jeevana. Thanks for having me.
All right. Take care.
Stay safe, everybody.
Okay. Bye.
Bye.